Virus cases continue to surge here in the state. Local health officials are still waiting for the state's guidelines on how distribution of the coronavirus vaccine is going to work.
But in the meantime, hospitals across Massachusetts are gearing up with their own plans. Western Mass News reporter Sarah Gurnelli joins us live with the very latest. Sarah?
Jordan, Chris, Bay State and Mercy health officials both say that they're going to be giving their colleagues the COVID-19 vaccine as soon as they get it. Massachusetts could see the first COVID-19 vaccinations by the middle of December. Pfizer and Moderna are expected to get authorized from the Food and Drug Administration within days.
Vaccination really is the key for us to return to the activities that we know previously. This is also very predictable. If there's a large enough population that receives an effective vaccine, then the infection rate will go down in the community.
Hospitals across the state are already planning for what giving the vaccine could look like. Dr. Robert Roos, Chief Medical Officer at Mercy Medical Center, tells Western Mass News they're planning strategically.
We will be ready to begin vaccination of our colleagues within a couple days after receipt of the vaccine. And we will be engaged in a program to try to vaccinate as many of our colleagues in the first 7 to 8 weeks while manufacturing and distribution ramps up.
President and CEO of Bay State Health, Dr. Mark Kerouac, echoing a similar message.
We have at Bay State developed an operational plan to open a vaccine distribution center for priority individuals. But given the numbers of vaccines we'll be getting, that likely will be healthcare workers only, and among healthcare workers, only those that are in the direct line of fire working directly with COVID patients.
Hospitals across Massachusetts are still waiting for the finalized version of the vaccine plan, and the state's draft healthcare workers, people who are at high risk, and other essential workers are at the top of the list to get the first shots. Meanwhile, Dr. Roos says it's important for everyone to understand that if you get a vaccine, you could notice some mild symptoms.
The process to develop immunity can sometimes create symptoms as the body is generating antibodies in an immune response that can be commonly experienced with many vaccines, like soreness in the arm or headache, or even a fever or chill. But it's clear that this is not from the virus itself. This is your body demonstrating an immune response to keep you safe and protected.
And so the governor says he is going to make some information available about the COVID-19 vaccine on Wednesday. For Western Mass News, I'm Sarah Gurnelli.